Hi, I'm Meg.
I'm Jill.
I'm Megan Lynn.
And these are the most frequently asked questions on Google about Botox. Alrighty, so first question of the day. What does Botox do for migraines? So we use Botox to relax the temporalis muscles and the masseter muscles. These are our chewing muscles. And patients who have chronic migraines typically carry a lot of tension in these muscles. So when we give them Botox, it helps relax the muscle and hence treats migraines preventatively.
Who gets Botox? Everybody should get Botox if it is safe for them to get Botox. There is a huge trend in the industry. People are getting Botox earlier and earlier and earlier. Most people are starting in their mid to late 20s, I would say. Male, female, old, young, everyone should get Botox if you're interested in taking care of your face and treating wrinkles.
Perfect. When does Botox start working? So this kind of varies based on the person, but typically we tell our patients 2 to 10 days. So depending on your metabolism and the treatment, it will usually start kicking in around the 2-day mark, and then you'll really feel its effects. For me personally, I feel like the peak hit me around day 10. Is that right, you guys?
Mine's about 24 hours. I noticed all my movement subsiding in 24 hours after injection.
And my 11s take a full 14 days to really reach its full effect.
It also will depend a little bit based on the muscle. So if it's going into a big muscle, like down here we treat masseters with Botox, those won't really feel the effects and really subside for more like those 2-week marks. But if it's up here like your normal wrinkles there, that's like the 2 to 10 days, and for each patient it might be a little bit different.
All right. How long does Botox treatment take? So the actual administering of Botox takes likely under 5 minutes. What takes the longest is taking pictures, getting your intake, and doing a really complete evaluation, evaluating your individual anatomy and the strength of your muscles and determining what is the most appropriate dose for you. So all in all, I would say expect to be at your first appointment 30 to 45 minutes, and then subsequent appointments, generally you're in and out in less than 30 minutes.
I think Botox newbies sometimes think that they'll be poked in the face for a good 45 minutes straight, and that's certainly not the case, right? It's the injection part's quick once you're all mapped out and pictures are taken. Is Botox a dermal filler? No, Botox is not a dermal filler. Botox is what we use to treat muscles and movement. Filler is typically hyaluronic acid, and it's used to treat areas of volume loss. So they are very different, but both used in aesthetic injecting to create a more youthful appearance.
Are Xeomin Dysport the same as Botox? So they're different brands, but they all are toxins. So they all work on the muscles. Their onset is pretty similar. They last the same duration. They are the same drug in theory, but they are different brand names. So all 3 of these should be working the same as brand name Botox would work.
I also think it's important to note that patients may develop preferences. I may prefer Xeomin, Jill may prefer Botox, and Megan may prefer Dysport, and that can totally happen within patient populations as well, even though they are all neuromodulators and all the same.
Right.
Their storage is a little bit different too, so sometimes that'll factor into costs. When you go to your appointment, don't be surprised if your injector is charging a little bit different, and it tends to stem from those types of costs.
Alrighty. Will Botox prevent wrinkles? Yes, it will. Botox will prevent wrinkles, especially if you're starting on Botox at a younger age. If you're a more mature patient who's just starting out on Botox, it will certainly treat the wrinkles and prevent further progression of wrinkles.
Go for it.
Where can I find a Botox injector? There are injectors everywhere. We recommend a healthcare professional that's been trained and certified. So you can go to the AAFE website and find a certified injector that's been trained through us. That's where I would absolutely recommend you go. But typically it's doctors, nurses, and other healthcare providers. We have a lot of dentists. They're experts at facial anatomy, so we train a lot of those as well.
Is Botox safe to use for everyone? Botox is contraindicated for women that are pregnant or lactating, as well as patients who have any sort of immunosuppressive diseases. And it's mostly for a lack of knowledge when it comes to pregnant or lactating women. No one's really willing to take that risk, and all of us are certainly not willing as injectors to take that risk either. So those patient populations are not safe to treat with toxin.
We have no proof that it's bad, but we also have no proof that it's okay. So avoid it.
Are there pre and post instructions for Botox patients? Yes, there are. So pre-instructions, pre-visit instructions for our patients, we always recommend avoiding anti-inflammatory medications and alcohol. So these two things can thin the blood and increase the risk for bruising and bleeding during your procedure, bruising obviously post-procedure. Post-procedure, we generally recommend do not touch your face. That is the most important instruction I can give you. We place Botox very strategically in the muscles that we want it in, and we don't want it in some surrounding muscles because that can tend to have a negative effect. So the most important thing is do not touch your face for 4 hours. Do not elevate your body temperature, so no exercising, no saunas. Don't go lay in the sun as the heat can break down a very fragile protein. No makeup if you can day of procedure. Day after procedure, you can do anything you want. Don't go home and lay down and take a nap on your face. What else am I missing?
No hats, no sunglasses, just
Right.
depending on where we put the toxin.
So those
Nothing
are the most
that would risk
important.
moving it.
Right.
Is Botox permanent? It is not.
Unfortunately.
Yeah. It'd be great if it was. But no, typically patients get almost or about 3 months. Again, patient dependent. For Megan, how long do you get?
8 to 10 weeks.
Yeah, so it kind of depends on metabolism, depends on the muscles we're treating and your dosage. But appropriately dosed, it should last about at least that. She's young and has a really high metabolism. She works out twice a day. So she burns through it a little bit faster than, say, me. But it should last kind of coming up on 3 months, patient dependent. You can expect that it'll wear off, though. So even if you don't like the way everything laid, it's not permanent. So there's the good news there.
All right, who can legally administer Botox? So this is dependent state to state. I think 46 to 48 states out of the 50, you have to be at least a registered nurse. So registered nurse, nurse practitioner, dentist, medical doctor, those sorts of things. There are a few states that allow medical estheticians to inject, but those states are very limited.
And the laws are always changing. So aesthetics is changing and growing. So what is true today might not be true tomorrow. So you really have to check with your individual state to know how the laws and litigation are playing out.
Thanks for watching. We hope you learned something with us today. And feel free to subscribe to our YouTube channel.
Bye!